everyone. Thank you so much for joining us today for episode 5 of season 3 of Revise and Resubmit. I'm Dr. Kim Bissell, the Southern Progress Endowed Professor in Magazine Journalism and the Associate Dean for Research in the College of Communication and Information Sciences at the University of Alabama.
And I'm Dr. Annalisa Bowen, an assistant professor in the Department of Communication Studies, also at the University of Alabama. And we both work in the Institute for Communication and Information Research, or the ICIR, at UA.
Today, we catch up with one of our more recent graduates from C&IS, Dr. Eric Cook, who is now a postdoctoral fellow in the STEM Translational Communication Center at the University of Florida.
So, Kim, you know those phrases, I'm not a doctor, I just play one on TV. and then maybe not a real phrase, but I say it often, I'm not a doctor. Oh, wait, no, I am. I'm just not that kind of doctor, referring to being an MD. And I tend to put MDs and PhDs in two different categories, even though I know that there are people out there who are MD, PhDs. And I mean, that's mind-blowing.
Mind-blowing, yes.
Did you know that you could do a clinical trial or clinical trial research even if you're not an MD?
Okay, great question. I think maybe I had this inkling that those of us in communication could maybe get involved, but I wasn't sure what it looked like. So I guess the answer is a solid maybe.
And we're going to learn how actually that is super possible today in our conversation with Eric. And we're going to learn all about the importance of communication when studying things like health disparities. And we're going to learn even more about what the nature of his research looks like. And that is, yes, there is a place for those of us in communication to do medical research. And not even just like a place and a space, but there's value and a need for communication scholars to get involved in medical research, like not as participants, but as researchers. And I also want to tease just a little bit here. When we talk to Eric about his research, we're going to talk about virtual assistants. If you've been listening to our podcast, that might sound familiar. Back in season 1, we learned about virtual assistants when we talked to Dr. Miriam Sweeney. Today, different application of virtual assistants, not any less interesting.
Not at all. And one of the things that we touch on in this conversation with Eric is how things like culture certainly play a role in understanding the different ways to approach research within diverse communities.
And I tell you what, Kim, it has been so much fun learning about each of our guests' path to the PhD and the decisions they made that help bring shape to what they're doing now. That's no different with today's conversation with Eric. Please join us in welcoming Dr. Eric Cook.
Eric, we are so excited to be catching up with you today. Thank you for joining us.
Absolutely. Thank you both for having me. Happy to be here.
So, Eric, this season we are catching up with C&IS alum who have gone on to do really cool and great things elsewhere. And we are finding out that many of our guests are now at rival SEC institutions, and you are one of them. So, my very first question to you is, how much orange and blue are you wearing? Or is it still crimson and houndstooth?
So yeah, that's a good question. I'm down here at the University of Florida, so I don't own anything Florida related actually. So that's been kind of that's been an ongoing joke in my department that that somebody's going to buy me a Florida t-shirt just to wear around. So yeah, I haven't been fully immersed in the culture yet. So still hanging on.
Good for you. Roll Tide.
Stay strong. Yes. Stay strong. Eric, since you are not currently at the University of Alabama, we would love for you to give us some basic information about who you are and what you do. We call this our rapid fire section, kind of get to know you part of the podcast.
All right. So first, where are you from or where did you grow up?
Yeah, so I was born in Tuscaloosa, actually, Druid City Hospital. My father was in the military, so we were stationed a couple of places
Hmm.
in Germany and in Maryland. I spent the majority of my childhood in Maryland and moved back to Alabama. So I graduated from high school at Central High School in Tuscaloosa. Go Falcons! And yeah, I did my all of my education at UA, undergrad, master's, and PhD, and I finished the doctoral program in C&IS in August of 2020, I believe. This last year and a half has been a blur, as I'm sure everybody knows, but yeah, and now I'm in Gainesville doing a postdoc at the University of Florida.
Oh, perfect. Okay, so tell us what department you are in at UF.
Yeah, so I'm in the College of Communication and Journalism, um, and I am positioned with Dr. Janice Kreiger in the STEM Translational Communication Center,
Excellent.
and I'm working with her on her on her clinical trial.
Cool.
That's
Yeah,
awesome.
yeah.
Also, an alum from that particular college. So a little bit of me sometimes has a little bit of orange and blue on, but that's not relevant. All right. So what did the young Eric think he was going to be doing when he grew up? Did you always kind of envision yourself in academia? Did you ever say, the 8-year-old Eric, I'm going to be a professor when I grow up? What did you see yourself?
So I always, like many, probably many young men of color, I wanted to be a basketball player. So that was always something that I had a dream. But as I got into high school, I was like, I don't know if I have the talent for this. So I had to make some hard decisions there in my late teens. So yeah, definitely did not foresee myself kind of progressing in this field. Definitely, even after I started, with in the master's program and even in the doctoral program, I always kind of, just thought that, oh, I don't want to go into academia. I would prefer industry, so I can just do research. And that was mainly motivated by a fear of teaching. So I
Oh,
I did
Wow.
not want to teach. I was like, I can't do it. Like just major anxiety and so I had some good mentors, Joseph Phelps, Mike Little, Kim, you of course kind of helped me just to getting in there for the first time and just kind of overcoming some of those fears and phobias. So yeah, that was kind of once I was able to bypass that, I just figured that anything that came my way, I'd be able to handle it that way. So yeah.
so I think that's really interesting. And I think a like a thank you for sharing that, because I think that
Mhm.
there's a lot of folks who would say or be in that same boat of like I teach what
Right.
like
Right.
there's like lots of levels there. Like for me, I was like, when I first got the teaching assignment, I was like, ooh, that's like public speaking. No, 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 thank you. Which seems weird, right? When you're in a communication field, people automatically just think that you are a public speaker and a teacher and a like brilliant communicator. And
Mhm.
internally, there's doubt about that often.
Sure. Absolutely. Yeah, I think and you all of that, and you don't understand how much goes into the prep and
Mm.
um, just kind of understanding. I guess who was it, Einstein that said if you don't understand it, if you can't explain it simply, then you don't understand it well enough. Well, sometimes that I feel like can convey itself through teaching. Just trying to figure out how to convey what could be complex ideas in a manner that is understandable by undergrad students. I think it's a lot more difficult than you think on the flip side, being in
Yeah.
the audience. So yeah. So yeah, but through my teaching experience, definitely learned a lot. I'm not currently teaching right now in my postdoc, but um, I do feel comfortable that in the future, if I were to move on to a full-time professorship, that I feel confident in my teaching ability.
Well, Eric, I think it's definitely worth noting that you are not the first podcast guest to have mentioned aspiring to be a professional athlete. It's been a little bit of a trend, which
Oh,
I
really?
find
Okay. Okay. Good.
kind of cool. Like, secretly we all wanted to be a pro basketball player, a tennis player, or a football player.
I want to
Excellent.
be a referee. I knew that I wanted to be like one of those referees that was like really over the top in how I called plays. It didn't happen.
That might be the first time I've heard of that being a childhood dream, being a professional
I was
referee.
just
Okay.
thinking that too. I've
Yeah.
never heard that. I aspired to be a referee. So I want to shift gears just a little bit on you, Eric, and talk a
Mhm.
little bit more about the scholarship that you have done, that you're currently doing. Can you give us an elevator pitch on your research?
Yeah, so my current research centers around cancer health disparities. So, more specifically, how we can leverage communication technology to address barriers, patient barriers, and to promote colon cancer screening. So, that's the clinical trial that I am conducting research with right now. Um, just very briefly, the project centers around the use of virtual humans, virtual health assistants, which people might have seen with the growth of telehealth now. Some of these things are becoming more prevalent. So this technology is highly can be highly tailored and customized. So it can be developed in a way that is targeted and that is most appropriate for different populations, different audiences. So with the goal of providing patient education. So in regards to health disparities, right, a lot of times you see there's issues with access, issues with cost, stigma, many other things. So we're trying to figure out how we can leverage this technology to both motivate patients, but also to be able to increase their access, in particular during COVID, as we've seen, issues with access across the board, really, and cancer screenings being put off as well. Uh, so yeah, that's kind of just a quick summary.
So, Eric, I wanted to follow up on something that you had just said, just to make sure everybody understands what you're talking about. You had mentioned that in the research that you were doing right now, it's in the clinical trial phase. Can you explain what
Mhm.
that means to our listeners?
Yeah, so this study is funded through the National Institutes of Health, and what we do is we recruit patients. So we partner with UF Health, and we recruit patients between the ages of 50 to 73. And we're moving down to 45 of note because the U.S. Preventative Health Services, I'm sorry, the U.S. Preventative Services Task Force, which kind of is one of the governing bodies that recently reduced the recommended screening age to 45. It's because the rates of young onset colon cancer are rising. Um, so we recruit patients that are not currently up to date with their colon cancer screening, and we invite them to take part in this virtual intervention. Um, and then the outcome measure that we're going to be looking to assess at the end is going to be related to whether or not the main outcome is going to be related to whether or not they go on to be screened. Um,
Mm.
so really, just the clinical trial kind of centers around just the nature of the research.
So, Eric, I mean, you said that you got your education at the University of Alabama, and
Mhm.
I know that you have a PhD in communication and information sciences. That's why you're our guest. Did you also get a medical degree? So how are you working with all of this health stuff um, as a communication scholar?
Yeah, yeah. So I've always had an interest in health communication. So I was able, the way I got this position in the beginning was I was able to leverage some of my work experience, professional work experience. So in addition to being a doctoral student, I had a full-time position at the university managing different research studies. And one of the research studies that I managed was was an intervention to reduce HIV-related stigma among within rural Black churches in Alabama.
Mhm.
So I was able to get a couple of publications from that and some good experience in terms of project management. And having that practical experience kind of opened me up for this opportunity to be able to come in and just really just to grow within this team, right? So, I didn't come in, I didn't know much about, cancer health disparities coming in. I just kind of had a very basic, understanding of it. And then, obviously communication principles that are being used in the actual messaging of the intervention. Um, so yeah, I think that was what really set me apart was my kind of knowledge of day to day how to administer a large research project.
So you're saying you don't have to be an MD to in
Oh no.
in research that involves health, which I think is very cool and kind of inspiring.
Yeah, yeah, no, not at all. So our team, and you all probably know this, working a lot with grants, right? So the grant funding agencies are typically going to be looking for teams for multidisciplinary collaborative teams, right? So our team, we have physicians and providers and computer scientists and data scientists and also communication scholars that focus in health disparities. Each person kind of bringing their own expertise to the table. So yeah, I think things are really moving more towards a kind of team based approach, definitely to these large grant funded
Mhm.
projects. So yeah, definitely don't need to be to have a medical degree.
So, Eric, to follow up again on kind of this line of thinking, could you provide for our listeners what we mean by the term health disparities? And could you elaborate a little bit on the importance of doing research in this area?
Sure, yeah. So now kind of present that through the context of of colon cancer. So right now, what I guess maybe the general principle is that, for example, black patients, black African Americans in this country make up a relatively smaller percentage of the population compared to their incidence and mortality rates from colon cancer. So that's kind of there's a disparity in terms of the size of the population against the rates of the disease in that particular population. So you see health disparities centered around many different things. Race, and two of the things we're looking at is race and urban versus rural disparities too. You see a lot of health disparities among rural populations. Um, so, of course, it's definitely important to kind of try to address these things because of you know mainly due to the need to kind of better serve these underrepresented and underserved populations. Many times there's a lot of barriers which keep people from being able to receive the timely screening care that they need, access, social economic status, lack of knowledge, um, many others. So so yeah, I think that those are probably some of the main rationales I think behind the need to address these health disparities.
So I'm gonna put you on the spot just for a second
Mhm.
here. I know this clinical trial is, I mean, it's still in a trial phase, right?
Mhm.
But think about this work that you're doing and any of the other work that you have done And if you had to come up with a headline for one of your most interesting findings across all of your research, what might that be?
Yeah. So in face-to-face settings, right, patient-provider interactions in person, some research shows that when patients are able to engage with a provider that is from a similar demographic background, whether that be race, ethnicity, et cetera, that they tend to report greater satisfaction and can sometimes have better health outcomes, even though that literature is a little mixed. So kind of what we're looking at from this telehealth perspective, being again that this virtual technology can be highly customized, is whether or not matching patients with a virtual physician or virtual clinician that is of a similar demographic background, whether or not we are seeing differences based on that. So, kind of some of the things that we're seeing from some preliminary data would suggest that that matching folks with a demographically similar virtual health assistant does have some positive effects on their intentions to screen, and also that it is important to kind of focus on the way that these virtual agents look, right? So that's kind of a tech perspective in that people might be more persuaded and more motivated to take on behavior that is promoted from a virtual agent that might have a better look, like that they self-report as they like the way that it looks. So we're kind of transitioning that from kind of a social cognitive or social influence perspective, in that people tend to be motivated and persuaded by social models that they feel might have a better look. So yeah,
But I
those would probably be the two main findings.
But that makes so much sense when you think about it, though, because I think in this age where we are finding ourselves questioning so much of the information we receive, regardless of the sources, when you think about kind of a healthcare context, there may be this assumption or belief, and I'm not saying it's not the case at all, but if we're talking to someone who seems to be similar to us, whether it's demographically or otherwise, then maybe it's easier to believe that that person can kind of understand us. It's just like
Mhm.
that the age old adage, you go into the doctor's office, the doctor walks in, no, I'm not trying to throw shade toward MDs at all. Doctor walks in, reading the chart, having looked at the chart for 30 seconds, and then, making an assessment based on that glance at your chart. And so I think, what you're talking about makes perfect sense, especially in this environment where we're finding ourselves questioning so much
Mhm.
health and medical information.
Well,
Definitely.
I've got an idea here, and if anyone wants to scoop me on this, I guess it's fine. But one is, what would make me maybe do a screening, persuade me more, is like a cameo by Kevin Bacon. So I don't know if there's any grant work in there, but
Yeah, yeah.
and I'm
No,
like,
that's interesting.
I'm also thinking like, so this is totally not the direction. I'm just also thinking like, if I could pick a physician accent, a virtual physician or clinician accent, and have a British one
Mm.
talking to me, maybe that's the route I want to go. So when you're doing these virtual clinicians and physicians, like are there, do you guys as the researchers pick based on the patient demographics, or is there like an option for the patient to select
Mhm.
what
That's a
their
great question.
virtual experience is like?
So for the clinical trial, we're doing a random
Oh.
random treatment. So patients will see a random version. So we have we are able to randomize based off race, gender, and language.
Mm.
So we have an English speaking version and a Spanish speaking version. And we've hired voiceover actors, professional voiceover actors. But
Oh, that's
in terms of, yeah, that was a great point that you made though about the voice, because
Mm-hmm.
one of the main goals of these interventions is to make them scalable. So after the end of the clinical trial, right, how to kind of integrate these things into the clinics. So one of the things we're thinking about is, are there differences between a more, I don't want to say voice to text, but something kind of similar to that, or text to voice, a more computerized voice, as opposed to, hiring professional voiceover actors. So yeah,
mhm.
that is something that folks are thinking about for sure.
I think a lot of us, when we think about virtual stuff, assistants and clinicians, and so we like kind of think about the Siri or Alexa, or I'm sure Alexa's going to talk to me in a second, or directions and that sort of thing. So I think that this is a very cool application
Mm-hmm.
uh,
Mhm.
of virtual assistants that maybe at least I hadn't even thought about before.
So, Eric, shifting gears just a little bit, we're going to force you to think a little bit about what you consider to be a success of yours. When you think about your professional career, whether it's work that you've done, a project you've been involved in, a publication that you've gotten, what's something that you are kind of proud of or really proud of?
Uh,
You can embrace it
yeah,
too.
yeah. I was thinking about this. So this might sound cliche, or what may not be the right term, but yeah, I'm really just proud of just making it as far as I have. Just kind of being where I'm at. I'm really thankful and grateful. Just definitely had to overcome some things. Just as all of us do. So yeah, I'm definitely proud of myself for kind of being able um, to set a goal and to reach it. I think that it's important to kind of take a step back and you know pat yourself on the back when you can, as for a job well done. But of course, always continuing to set the bar higher for yourself. So yeah, just being able to do the PhD, getting the postdoc, working with a great team, continuing to do research that I'm proud of. I think all of those things are kind of combined into that one thought. And
Well,
yeah,
and
so I'm
I think
definitely thankful. So,
I think that's, what you just said about taking a step back and kind of allowing ourselves to think about what it is we have done. I think that's an important uh, message for all of our listeners. So we're going to shift gears on you again. That's what this podcast is all about. We're always shifting gears. Before our listeners who are newer to academia or newer to communication research, um,
mhm.
what we've been asking some of our guests to talk to us about is what keeps them motivated. Part of what we do in our jobs can really get down to minutia, and it can be really hard to push through. So, what works for you? How do you stay motivated?
Yeah, that's a great question. So for me, what keeps me motivated is my family. Um, I'm a young daughter, so having a family that you need to provide for definitely is a strong motivator for me. But I think as well, kind of going through the dissertation process and going through a program with such great faculty, I was able to develop some strong habits, some strong writing habits that I feel like are carrying over. So um, into the postdoc, because for those who might be going into postdoc, and I'm sure it probably works that way as well when you're on a tenure track, that You definitely need to have a strong writing habit if you're want to do a lot of research.
Mm-hmm.
So yeah, I think that that's something that keeps me motivated are those skills and practices that I built and have been able to carry over. And lastly, I would just say like working with a team of individuals that are highly ambitious. So I was able to partner with. I joined when I was at UA. I worked with Matt Barnage's lab, and that was a great experience. Learned a lot of things uh, about team science and how to work in a team environment, and also here at UF, just being with this group of folks, everybody's really striving for a lot. So that's definitely something that keeps me motivated as well. Just being around those type of people. So yeah, I think one of my and I'll stop talking here, but I
No.
think that one of my strongest things was being able to find good mentors that could help me kind of get to my next stage. So for those that are coming up, I would definitely keep that in mind. You want to keep folks around you that are going to push you and that also have your best interest in mind. So
Exactly.
And
Surround yourself with good people.
what I hear you saying too is assignments that have like paper assignments or dissertations and those that they have like a real purpose. It's not just busy
For
work.
sure.
yes, group work has a purpose, guys. Yeah. But honestly, that's something that I've kind of been struggling with a little bit. I'll be honest, because coming from like where I was at, and definitely for like the dissertation, you're doing it all like you do that yourself. You might tend to do a lot of your writing by yourself, or that might be the way that you like to work. But when you're working on grants, you have to kind of learn how to really manage a manuscript team. So that's the next area of growth for me personally, just kind of having that vision of a manuscript when you have a 25 or 50 60% draft, but still having that vision of, okay, this is where this paper's going. So Kim, I would like for you to work on this, for
Mm-hmm.
example, right? So just
Mm-hmm.
being able to kind of manage it in that way, I think, is something, if I were to give advice to folks coming up, would be able to think about how you might do that. So
Great response.
Yeah.
mhm.
All right, Eric, we're going to finish in a little bit of the same way that we started with a rapid fire question or two. So, what academic conference are you looking forward to attending in the future? When? Current person?
Well, I would probably take any place that gets me out of whatever town I'm in, to be honest. But where we going, it doesn't matter. But I hear that ICA is in Paris coming up, so that's definitely one I've got marked on my calendar. So that November deadline, I'm definitely prepping to see what I can get in,
Excellent.
get
Not gonna
submitted
lie,
there.
this is also not the first time we've heard that answer.
Yeah, I'm sure that's on high on everybody's radar.
Folks are gonna they're be like, we've listened to this podcast, and people are saying they'll go.
Oh,
So we're going to have a conference in Jackson, Mississippi. Not that Jackson, Mississippi isn't lovely. I've been a lot, but it's not. It's not Paris.
It's not fair.
no,
Yeah.
no, no. They have really good food in Jackson though, so that would be one benefit.
Eric, we want to thank you for taking the time in your day to catch up with us. Tell us a little bit about all that you have going on in your postdoc at UF. Thank you for joining us. It's been so fun to talk to you today.
Absolutely, absolutely. Thank you all for having me.
Thanks, Eric.
Bye.
Thank you guys.